this is by Health Innovation Oxford and Thames Valley. And it's one of our Innovator Toolkit series. This is one of 7 webinars we're going to be running through April. This one's about developing an effective value proposition for healthcare. So specific at the NHS, but it's applicable to any healthcare setting you might want to work on. We've got a few slides to go through. First of all, I'm going to introduce who we are, Health Innovation Oxford and Thames Valley. I'll introduce myself, and then we'll get into the content, really looking at what is a value proposition, different ways to start developing it and testing it out, where you can use it, and then some other ideas and resources with a bit of opportunity for questions at the end, if you will. Okay, so I'll kick off. So who are we? So introducing Health Innovation Oxford and Thames Valley. You might know us as Oxford AHSN. That was what we were before a few months ago. So the name changed, but we are the same organization and doing exactly the same stuff. So it's not a change there. So we're going to record this session. So we're going to put it on later onto YouTube for those who might want to catch it later. We'll also send out the slides. So don't worry about writing everything down. We'll give you a PDF set of these slides. It's got links in there and all the information, so you don't feel you have to write so much. Hopefully that helps out a little bit. So Health Innovation Oxford and Thames Valley. So we've been going for 10 years and working with partners in the NHS, universities and industry for those 10 years since 2013. We're mainly commissioned by 2 bodies, NHS England and the Office for Life Sciences. And our job is really, our role is accelerating adoption and the spread of innovation within the NHS and healthcare, aiming to improve outcomes, experience, patient safety, addressing health inequalities, and essentially saving the NHS money, but also delivering economic growth to companies working with the NHS. We serve a region of about 3 million people in Buckinghamshire, Berkshire, Oxfordshire, Frimley, and Milton Keynes. It's kind of the Thames Valley area. That's the Thames Valley part of our name. We try to match high-value innovations with identified population needs. So what's needed against what's available. And we're empowering NHS staff to do that and also to understand what they can see outside the NHS that might be brought in, and equally taking things from the NHS back out if necessary. And we've got 4 main clinical priorities: cardiovascular disease, maternity and neonatal, mental health, and respiratory disease, although we work along lots of other areas as well, regionally and nationally, and internationally in some cases as well, drive kind of best practice and innovation in all those. You might know this already. When we were AHSNs, the same things as HINs, or Health Innovation Networks. So we are one of 15 health innovation networks, and collectively we are known as the Health Innovation Network, which is all the 15. You can see it covers all of England. We work closely with our partners in Wales, Scotland, and Northern Ireland as well, as part of a UK kind of mission to get all that done really well. And we were relicensed in the last year until 2028. So another 5-year license to continue doing what we're doing. Few tweaks, but essentially doing the same work that we're doing. So if you're familiar with what we did as AHSNs, we're doing the same work as Health Innovation Networks. And it's really just looking at different things we've done. You can see all the different kind of key elements we've done as Health Innovation Oxford and Thames Valley, helping to support different tools, different areas, safety, innovation, all sorts of different bits and pieces. We'll get the slides out to you later so you can look at this if it's a bit small on screen. There's a lot of detail in there. These are all available on our website as well, just so you know. Okay, so that's kind of the background of kind of who we are as Health Innovation Oxford and Thames Valley. As a quick one, I'll do a quick introduction to myself. I'm Matthew Lawrence. I'm Head of Industry and Innovation, and I'm one of our team of about 50 people in the organization. And my function is to work with industry. So those outside the NHS to understand really what the NHS is, how it works, what they're looking for, what their priorities are. And there's also to work with the NHS to better kind of signal what they want industry to help them kind of solve. There's some things that are already off the shelf. There's some things which we don't know, but we want to kind of drive and help develop going forward. And that's really kind of where that comes in. My background is I've been in the NHS for 16 years now. Before that, I worked in industry. So I've worked in multinationals and national companies around technology predominantly and around kind of medicine and different things like that. Within the NHS, I've worked in pretty much every setting, from primary care, secondary care, tertiary, community, mental health, commissioning. And I was seconded to NHS England for 9 months a few years ago to really see how they're doing that from the centre, driving all the policy. So I've kind of seen lots of bits of it. Some of it's changed. Things are always changing in the NHS. It's kind of my background and kind of what I'm doing and how we do that. So into the main content of this webinar, which is developing a healthcare value proposition. Now, you may have heard the term value proposition before, so this is really going to be focused on healthcare specifically. It's a little bit different, so it's not selling a retail product like soap or something like that. It's quite specific to what the NHS and the healthcare needs. So to define it, so a value proposition shows your innovation meets an unmet need. Now, we'll kind of unpick those terms, but essentially, it needs to say why your innovation, one, is really innovative, and also how it's going to solve a problem for somebody. They may not know they have that problem, but it's a matter of doing that. So it succinctly outlines and demonstrates your innovation's market need, so what's needed in the market that your innovation solves. Evidence reviews, so what evidence you have that it does that. Not just that you think it, but you've got some evidence behind it. You've done some stakeholder research. So if you're aiming this at a certain part of healthcare, you've done a little bit of qualitative or quantitative research to find out that actually it's well received there. You've got some insights into how they work or what their problems might be, and you have a strategy behind that, how it's going to do that. So this little kind of template here, this kind of word kind of puzzle, is taken from strategizer.com, and they've got their own value proposition template. And essentially, we'll work through some tools later that will help you fill this in. But essentially, you're saying fill in your product here. Our product helps who you're helping, who want to do something specific, how it does it, by, and then you don't have to, might want to say how it's different than something that exists already, or something that might be a competitor. So really understanding this, that's a very succinct way of understanding and expressing all of that. Now, it's a lot to unpack. We'll do that over the next few slides to see how you get that information in there. But it's really a way that once you've done that thinking and talking and testing your proposition, you can then, in a very shorthand way, express something that actually seems useful. Rather than just talking about benefits, you're actually talking about something that goes to who your target market is. So it translates your innovation into a value-based solution to meet an unmet need. And now the question, kind of looking at it the other way, is why don't great innovations go forward? Now, sometimes things are better, but they don't go forward. The reasons generally are they don't match a recognized problem. It might solve a problem, but if the customers or the market you're aiming at don't recognize it as a problem, they're probably not going to purchase it or use it, or they won't give you the time to implement it. It may not demonstrate affordability. This is obviously a really big one for healthcare, particularly the NHS. If you look at what's going on now, there isn't enough money going around. They need to be really, really cautious what they spend money on, but also their time, because time is money with too few clinicians and managers and everything to run the service. They don't have time to do things that will take a long time. And it's got to show how it's going to impact the system. So if you just say this will work overnight, people are going to be very reluctant to believe that. They're going to want to know how it's going to impact and what they need to do to make it happen. And also, you need to explain how the innovation works to NHS staff. So if you don't do that, you won't get the buy-in from the users and the stakeholders. So someone at the top might buy something, but if you want doctors, nurses, clinicians at all levels to start using it, they'll need to understand how they get trained, how they use it. If they don't think it matches what they want, if they don't think it's safe, they will not use it. It's not a maybe won't, they will not. People are registered and they've got their registration. They're not going to risk that with something that's not proven as safe against what they're using already. So those are things to kind of consider going forward. Now, developing that proposition usually starts with understanding your customer. So most businesses will say, look at your customers. That's going to be driving where you get your sales, where you develop things from. Understanding that requires a recognition of NHS finances. So unfortunately, money is still really an important element of this. You understand who can buy it. So you might be talking to a doctor, a nurse, a physiotherapist, a pharmacist. That's great, but if they don't have the ability to buy anything because they don't have authority to do it, it's just them having to influence somebody else. So you need to understand how that fits into that. To get that understanding, you need to get in front of the right people, either virtually or in person. That's really challenging, the NHS. They don't give their time out very easily. That's where health innovation networks like us can help you kind of get early kind of understanding and possibly get you ready to have those conversations. And usually you want to get a clinical decision maker and a procurer, someone who can do that to help you get through. And you can identify them and as just partner like us or someone else to develop a proof of concept or real world evaluation. So if you're working with a hospital trust or a GP surgery, and they're happy to trial something as an evaluation, possibly for free or very basic cost, that can show how it works. And once you've got that first kind of beachhead customer explaining how it works for them, that's a testimonial that will really benefit you going forward. That's a challenge to get those first people, but that's a way of really proving that you understand their needs and their problems. So how do you create that compelling value proposition? So like I've said, the customer, you have to understand that target organization. So ways to do this, it's desk research, it's looking on the internet, possibly going to meetings, so board meetings. If you're interested in working with a hospital trust or integrated care system, they will have public meetings, board meetings and other things to engage. You can go to them or you can review the board papers. They will summarize what their challenges are. They might be financial, they might be performance, they might be quality or safety. Understand what those are. If you understand what those goals are, you can understand how best to target what you're trying to do with them. But understand the size of that organization. So Oxford University Hospitals, which is the big trust just down the road from here, they're an over £1 billion organization. So they're not small. It'd be hard to find the right person to talk to potentially. Whereas you might talk to a single GP practice, you might have 2 or 3 partners. They might be much more willing to give you some time if you can get in, but also they're not going to buy that much because they're much smaller. So you have to understand how it's going to be different for a small user as it would be for multi-site, trying to do something bigger than that. And then try and demonstrate how your product provides a solution. So it's not just here's a product for a product's sake. What is the problem you're meeting? So how's the solution there? So staffing, as I alluded to earlier, is a really big problem for the NHS now. There aren't enough doctors, there aren't enough nurses to deal with the work that's there. So if you can find a way to free up staff capacity, to help them learn quicker or to do more for the same thing, that's going to be a benefit as well. Think about all the things that are challenging the NHS. The NHS long-term plan is a document published by NHS England that lays out what they want to do over the next 5 years. The really big challenges for the NHS. And they're not surprises, they're things that you'll understand. You'll have to solve every one of them, but if you understand that's the background to everything, much easier going forward. Next bit, be very clear about what you're offering and what the costs are. So essentially, don't promise something that's going to solve everything. Most people won't believe that. But if you can solve something that's discrete and really well described, you understand what the cost is going to be and where that cost comes in. That's going to be really helpful going forward. And then you build your value proposition using the dimensions of a value equation. We'll get into that next. So it's kind of like, because of this, that. So how does your product help the NHS maximize its use of its resources and improve patient outcomes? It's really, if I spend the money here, will it save money there? Or will it give me a benefit in some other area that's worth that investment? That's really the equation. So is it kind of a cost-benefit analysis on that? So there are 2 approaches to this. I'll go to the first one, which is kind of more traditional way of doing it. It's much kind of NHS specific. So you're looking at kind of a 12-point matrix where you've got the patient on one bit, the service, and then national. So patient is obviously the person receiving the care. The service could be a hospital trust. It could be a service that covers a whole region or an area or nationally. And nationally, what's the kind of priority area around that? So look at those 3 kind of areas of it. And then what you're trying to define are those 4 bits you see across the top and on the left there. The problem, what's the context? So understanding, let's say there are 5,000 people on a waiting list for a certain service. That could be the baseline. And prevalence, those people tend to be of this age group or something like that. And where it sits in the long-term plan or the local kind of priority thing. Getting into that, because of that, what's the consequence of that? Because there are 5,000 people on this waiting list, that is then causing more people to become unwell as they wait for treatment or wait for a diagnosis or wait for initial appointment. That's a problem. So the intervention, this is where your innovation would come in. What's your innovation do? So it can confirm the transition to delivery challenges. So because of this new innovation, you can get processed twice as many people as you could before. So therefore, you can reduce that waiting list down, for instance, and the impact change and consequence. Because of that, fewer people will go on to have other problems. They won't go to A&E. They won't have to have more medicines. They may not die or have kind of more disabling disease that comes out of that because of that. Those are ways to express that using real language, real evidence to kind of support you. So kind of example questions. This is quite small. You will get a PDF of this later if you want to look at this stuff. There's some links where you can look at other kind of resources around it. But kind of questions you want to ask around. I won't go through all of these, but it's kind of the first ones. So for the patient and the person being affected, for the problem a bit. So who's this aimed at? So let's say it is men between the ages of 30 and 35 who have liver disease. You could say that. How does it affect them? What does it do? All that kind of stuff. So you're trying to demonstrate your understanding of what the challenge and problem is. And the consequence of that, because they have liver disease, it may affect lots of different areas. How does this compare with other things that they might have costs or challenges going on. The intervention, who's going to be affected by this? Will it be all 5,000 of those patients on that waiting list, or is it going to be a very small subset? Like sometimes a small subset is just as useful. You don't just solve every problem. If you can solve a very specific problem in a very specific way that is provable, that is really beneficial. And then the impact. If you can take them out of a waiting list, you can treat them quicker, or you could find some other way, those are really useful. And then you're looking at that at a service level and a national level as well. Thinking about those kind of bits all the way through. This is a really kind of from the ground up way of thinking about it. What we're really trying to give you here is a foundational understanding of kind of how to consider what you have as innovation, how it works for those who are going to be receiving it and hearing it, giving you feedback, hopefully, about how they see that fitting or not fitting what they want. So there's a checklist here. Again, lots of words to go through. But when you've gone through a kind of a value proposition, check that you've done all these things. You've set the scene. You've talked about the unmet need, the consequences of that. What is the intervention? So I meet with lots of companies and lots of innovators every year. Sometimes it's hard to know what the innovation is because they haven't expressed it clearly. They probably have a really good idea in their mind, but they haven't been able to explain it. So if it's a digital one, where does it fit in the pathway? Who's accessing it? How will they access it? Or if it's a medicine or if it's a device, who can use it? What kind of training is it? All those kind of things have to be answered. And really the thing the NHS is looking for, a nice National Institutes for Health and Care Excellence, they'll be looking at is what is the impact or benefit? And is it worth the investment, the time that goes involved in that? You can get all these kind of data from different places. We can help to find that for you as a health innovation network, but obviously the trusts and the clinicians and the patients might know this as well. So there's lots of different sources for that. Now, a second approach, this is from strategizer.com, which you can go online and you can download all their tools. They've got something called the Value Proposition Canvas. And you can apply that to healthcare, or you can apply it to virtually any customer-focused business, which is pretty much every business. And you've got two sides to this. There's one which is the customer segment here on the right, and you've got a kind of an other side, which is kind of your product and your organization here. Now, if you look at this, what you're really trying to develop here is looking at how you're going to break it down. So I'm going to go on to the next slide and show you. So instructions. So you'd start on the right-hand side here. So it might be a bit small. If you can't see, you can probably zoom in a bit if you want. But start with your customer. Always a good place to start anyway. You start sketching out a map of what that customer needs to do. We're talking about a very specific customer. So if you're talking about a healthcare organization, you might say, this is a nurse who needs to do something. They need to work with a patient in outpatients or do surgery or something. Be very, very specific what they need to do. These are the customer jobs, things they need to get done. We're not talking about, showing up, having a coffee, sitting down. Not the job. The job is, what are they doing? So let's say it is booking people into outpatient appointments and making sure they've done everything. That could be the job. And then you add the gains and pains. So the gains and pains are what they're trying to do. They're trying to treat as many patients as possible to get them healthy and get them well. But the pains are the things that make it hard for them. So it might not be a pain that you recognize as an external person, but for them, maybe it's that they have to print off a long sheet of these patients every day, and there are 100 of them. They've got to go there manually and tick them off. They've got to check things. If there were a more automated way of doing that, that's a pain that they're finding. And a gain would be they'd find more time, could do more stuff. So then you would then look at how you can relieve some of those pains. So maybe rather than printing off a sheet of 100 patients, you could prioritize them or triage them or something potentially. And what are the gain creators? Your tool, your innovation potentially will help you kind of do that and prioritize them better. And your product or service is called, triage list, or whatever you want to call it. And then what you're really trying to do is match those two things. So here on the customer side, what they need to do, what bothers them, their pains. Once you understand that, you're really talking to their problem. They'll understand that better. And then you mentioned, we'll go back into that thing, kind of into gain creators, the pain relievers, and the product and services you have that match those. And that's when you start getting real value in all of it. So when you look at that, you've got a layer of these value propositions you can match to the time you have to present. So once you've kind of broken it down, you understand it, you can look at kind of really, if you've got just a few seconds, you want something called a strap line, just a few seconds of work there. If you've got a bit longer, you can do something like a pitch. So let's say you've actually got a bit of time in front of someone. You've got 1 or 2, 3 minutes. So we get a value proposition conversation, like we're talking about developing all that stuff, it'd be like an hour. If you've got something to do multiple hours, you kind of pitch a bit more. The thing to remember, it isn't about product features and technology. Those might be great things that you have. You understand your product, your innovation, and you think it does lots and lots of stuff. That's great. But what you need to do is demonstrate that the customer needs something to do there. They need it to solve a problem for them that they recognize as a problem, and then you can develop it going forward. And then understanding what the impact of that's going to be. Now, the way that a business case in the NHS is usually started is, what's the do nothing solution? So essentially, if I don't do anything, if I just keep going as I am now, what's going to happen? You could say, if you don't do anything, let's say that waiting list will keep growing and growing and growing until it gets to be unwieldy. Are there workarounds that people could find other ways? Are there competitive approaches or other products and services that are out there? Consider all of those. But it's really about getting sustainability. So you've got it somewhere. It might be in one location. And then how would you make it go other places as well? And you really want to demonstrate that you kind of understand the market research on the problem, that there might be regulatory aspects to this. So another thing that I often hear is that a lot of people, innovators, companies, sometimes multinational companies, don't believe they need any regulatory kind of approvals for what they've got. And I'm not a regulatory expert, but the general thing is make sure that's actually true before you start to go to market. The worst thing is you go to market and they go, actually, this needs to be regulated because this is doing something that's in a regulated area. Healthcare is very highly regulated for obvious reasons, very risk averse. They want to make sure things are safe. And then real world validation in an NHS service environment. It's another aspect that comes up quite regularly. So it might be a product that's been used somewhere else in the world, in the US, in Europe, in Asia, for instance. It's really popular, really well used there. But the NHS likes to see it used with an NHS population, which might be different. There might be different needs, different population, different kind of things going on. But also the way the NHS works might differ to how it works in other countries. So the model for payment, the model of the way that you can get things approved, the way that things are paid for in this country is very different than it is in other parts of the world. So you can't make assumptions about that. Just because it works in this place, it'll work in the NHS. So you want to get some local NHS kind of things. And NICE will ask for that before they will do any work to say, we should have this in the NHS. And a budget impact model. What it's really saying is, this is going to cost X per patient, per trust, per year. You understand how it's going to impact everything else. If it's going to save money, most finance directors I've worked with, they're always a little bit skeptical of any savings people quote. They want to see it in real life before they believe it. They'll say, I know what it costs, because I can see that's money going out, but getting it through the system, the complexity of the NHS makes it really hard sometimes to place things and guarantee a savings. So that's probably the hardest part to get for a big scale purchase. So if you've got a smaller cost innovation, it might be easier for them to try. So if it's £5,000, £10,000, it's an easier thing to get in than if it's £10 million. You can see the minimal work involved in doing that. And then you can understand kind of the funding to achieve those goals. A lot of work that we do as Health Innovation Networks is doing grant-funded applications for companies and NHS trusts as well. So the company could go to Innovate UK or any of the other kind of funding bodies in the UK and say, look, we think this is good. We want to do a proof of concept study on this. We do a feasibility study. We want to see how it works. And they will match fund or provide funding to allow you to do that, if you choose. Again, that's a choice for you guys to do. But once you win those grants, it's a good demonstrator to the NHS and to healthcare that actually what you're doing understands how the NHS works and it matches those needs really well. I was going to walk through the value proposition canvas a bit more, just go into a bit more detail there. And then what I'll do is I'll open up some questions as well in a bit. Just pull that up now. Hopefully you can now see this. So when we talk about the value proposition canvas, we were talking about a customer segment, and there's a guide to this. We can share the PDFs later. You can download them yourself. We were talking about customer jobs. So I was going to kind of talk through an example of this one. So the customer jobs, let's say we go back to the example of a nurse or a doctor or a clinical team having to manage a long outpatient list for an outpatient appointment in a hospital. Let's say they have 100 patients that show up every day. It's probably a bit high. Let's say it's 100 patients, just a nice round number. Their jobs are, one, get that list ready. Probably the day before or a few days before, get this list ready. They'll hopefully have already had an invite to attend on that day. They've got to get them, they might want to prioritize them. So they want to say, I want to see early on those patients who most need to be seen. And the patients at the end of that list may be the ones who are less of a priority, but still need to be seen. I'm going to do that. The way I currently do it is I print it off as a big, long set of sheets, lots of A4 sheets, maybe 25 per sheet, so 4 sheets of lots of information, lots of paper on there. And then as patients come in, I've got to call them out and do different things like that. So the pain there, you can imagine what those pains would be. If you've ever been to a hospital clinic or to your GP practice, the pain for the clinicians is that they've got to manage all those patients who might all attend at the same time and sit there waiting. Not great for the patient either to sit there with everybody else wondering when they're going to get seen. So the gains they're looking for is there a better way of doing it? They may not know what that better way is, but gain would be, I can see those patients more quickly, or I can triage them more effectively. So I'm not spending a day before doing that. And in that day, I can see more patients in an outpatient clinic or do something else. Another gain might be that it's safer. I'm not carrying bits of paper around. There might be a digital way of doing this, or a way of prioritizing them in different ways. All those different bits and pieces in there. So you'd write those down for a value proposition. And when you look at the guidance on this at Strategizer, if you go there, you'll see they talk about one value proposition. So it might just be one part of your innovation that matches that need specifically. The next one is the value map. This is the left-hand side of that same one we were talking about. So again, you've got your product or service over here. So you take one element of it. So it might be auto triage list, whatever it is, that functionality of your innovation. And again, we were talking about those pain relievers. So what it does, it might automatically go into the electronic patient record. It'll pull those patients out because it knows the day of the clinic. And based on some criteria you've already set, it will go through and triage those patients in a way that makes sense. It's not just alphabetical. It's not just by date of birth. It's using something that's clinically valid to help you kind of do that. So those are the pain relievers. And the gain creators are, you've just given back a day to a nurse and a clinical team and a doctor perhaps, who would have gone through and manually put these patients in a different order, talked about them, gone through different things. That's the gain creator. And then as we saw in the whole kind of map together, you've got the whole thing here. So you've got the customer jobs over here, the gains they're looking to achieve, the pains they suffer right now that they really want to get rid of. They may not know all of them, but they might, if you talk to them and have a chat with them, you might work it through. And then you, with your innovation, have these pain relievers that match these pains, gain creators that match to these gains, and the product or service overall that matches everything that the customer wants to do. That's really kind of the way to work it through and develop that and get through to it. So again, really useful way of thinking about different ways of doing it. And this is, it takes a bit of work. The thing to do is to think about really how you're going to do that. So once you've done that, I had an idea. This is really just a theory. It's a theory to test. So you've done that work. The next thing to do is to get some people to chat to, possibly, try and get 20 minutes with people if you can. If you can't get the actual clinicians, try and talk to people at a Health Innovation Network like us. We can be like a proxy. We speak to lots of clinicians. We understand lots of their regular pains that they mention all the time. We can help you kind of go through that and see. And then once it's ready and we're really confident you've got something that we can get you some actual clinicians who can give you some feedback. They may not be buying your product or your service right away, just to set your expectations, but they can give you feedback and say, that's not really a pain I have. Quite often an innovator thinks that a problem the NHS has. When you actually speak to the NHS services, they don't recognize that as a problem that's actually their problem. They go, actually, I can manage that one. What I really want is this thing over here. If you could do that, you go, okay. And often it doesn't have to be kind of earth-shatteringly amazing. It just has to be better than what they've got now. And sufficiently better that they're willing to help you co-develop it. And testing those things out with them. So essentially, that's what you're doing all the way through. So a value proposition is that equation. What have you got? Is it worth my time and effort to make it go through? I'm just going to jump through the next one. So to get help with it, so you can use those tools we just mentioned, or you can get in touch with us or any of the other 14 health innovation networks. We'll all have an initial discussion with any innovator who wants to come and talk about those things, get through that. You can contact us, you can email us, go to our website. The other things that we do, and I think I've got a few colleagues on as well today, is you can get help with real world evaluations. So if you have an innovation that is ready, it may be past regulatory approvals or it's just a concept stage, we can help you get real world evaluations where a real service will trial it for a few weeks. They'll give you some real feedback of the product was great, the cost was great, The problem was we couldn't figure out how to work it. The training wasn't there, or the training was great, but it's just really expensive. There's a little bit of soft kind of feedback and evaluation is really helpful. We can document that. We can partner with you on grant funding applications. And there are grants out there for tens of thousands of pounds. There are grants out there for millions of pounds. So it really can match what you need to do and where you need to do it in terms of where you are in your development process. We can help you with data collection. So if let's say you need to find out how many patients are affected by this, or who is it, where does it go? We can help work with you and health systems to figure out what those are, to get real evidence and conduct data that you can demonstrate again. And health economic analysis. A lot of what we do in our team, we've got a whole team run by our lead methodologist, and they can do health economic analysis for you, different kinds of health economic analysis that explains and will kind of justify some of the things you're talking about. There's a webinar that's also available on our website. I'll share the link for that, all around what is health economics, what is real world evaluation. You can find them on our YouTube channel, on our website as well. A lot more information in there. So I'll jump through the next two bits, and then I'll take some questions, and hopefully we can answer some things directly from you guys. These are the next ones coming up in the series. This is the first of 7, as you can see here, but there are a bunch more coming up through April. We'll send this out so you don't have to write it all down immediately. Resources, this will come out as a PDF as well. So you can Strategizer for free, get those templates. Understanding the value proposition walks you through that. Explanation from the NHS Innovation Service about the value proposition structure, so how it fits in the NHS, how it's used, and then links to us as Health Innovation Oxford and Thames Valley, how to develop it from a Health Innovation Networks way, and all the other webinars we've got as well. I can see there's a few hands up. Let me just go and check. Oh, okay, there's quite a few in there. So hopefully we've answered a couple of them. Reading through. So I think so. So looks like Mamta, my colleague, has answered a few of these questions already. Again, I think there's a few kind of bits in there. Trying to go to the last one. Okay. So proof guys, yeah. So I'll start from the last one if that's okay. So I can see there's one from Himanshi, I think. So it's So even with engagement with a health innovation network to conduct a POC, so proof of concept, proof of value, or real world evaluation, it's very difficult to onboard GP practices. They don't have time to do anything new, very true, which we know they are burdened with regular work. Money is an issue. Primary care won't do anything without being funded or paid for it. So how do companies go about this with help of a health innovation network? Okay, I'll pick that one up, and we might pick up a few other ones as well if they come in. Yeah, so I'll answer that first one. So I was actually a practice manager in a GP practice myself, so I understand exactly what you're talking about. GPs are very busy. Yes, you can know that they're working hard. Also, yes, the money. So a GP practice itself is very unlikely to buy something itself directly. So their budgets are very constrained. They get paid a capitated budget. So they get paid a bit of money for every patient on their books, which is not a lot. It's like £100-something a year for every patient. They also get paid kind of incentives to do different bits of work. So maybe do blood pressure, things like that. So the way to get into primary care is not directly through the GPs usually. I prove it works in a GP practice, but the primary care budgets come from NHS England, and most recently they have been delegated down to the integrated care systems. So in the Buckinghamshire, Oxfordshire, Berkshire West ICS, we're one of the 3 that we work with, you'd be wanting to work with the primary care commissioners who have a budget. And if they said that your innovation made sense, they could say, look, we want to trial this. They can essentially leverage what you've got, go to the primary care networks, which are groups of GP practices, and say, look, we want you to implement this over the next 3 to 6 months. We want to pay for the product itself. We will give you training. We will train the staff who need to use it. And we might also pay you another incentive scheme to actually do it. GPs are much more likely to do it that way. You'll find it very, very hard to go around every GP practice. So in Oxfordshire alone, there's probably 75 GP practices, and very few of them will buy anything directly themselves. They will, if the integrated care system says, they will go on the back of that and follow that training. That's the way to do GP stuff. But you'll be using the same techniques here. Who is your customer? So your customer, it might be the patient at the end of the day, but your customer, like a business-to-business relationship, will be whoever's going to be buying that product. In this case, it probably isn't the GP. They have to support it, It's probably going to be the primary care network, which is the larger group of GPs, or it's going to be the integrated care system, who will probably have a fund or a commissioner who's looking at primary care tools, and will have to match one of their priorities. So let's say it's reducing high blood pressure, and your product innovation helps do that, or it's helping to reduce the workload on GPs. That will work as well. So there you go. Other questions? So I think so. Mount has answered a few questions already. So that's great already. Trying to see which other. So see a question here. Okay, so health innovation networks, do they work with non-UK startups? That's a question. So yes, so every health innovation network will work with any company from anywhere in the world. The main thing is it has to be health and life sciences, really. And really what we're looking for is those who want to do something with the NHS in the UK. Not an absolute necessity, but for it to be free, we're funded to work with companies who have something for the UK or are based in the UK. That's what we're funded for. If it's going to be more work, there may be a fee involved. And sometimes that can be done through a grant-funded application. That might be the best thing in the world comes from somewhere else in the world. To bring that to the UK, the UK government might say, let's trial that. We can. So hopefully that helps understand that one as well.